Roughly 7 million Americans live in counties with little to no access to maternity care. That is according to a new report by the March of Dimes. These are areas without a hospital or a birthing center offering OB care or any providers. Data from this report shows that maternity care is only worsening across the country. Senior Vice President and Interim Chief Medical and Health Officer of the March of Dimes, Dr. Jakiba Henderson, with me now for more on this. Doctor, thank you so much for joining us. Between 2020,
thank you so much for having me.
No, it's such an important topic. And just looking at this 2-year data line between 2020, 2022, 8% of counties shifted maternity care classification, 94 counties increased access, while 153 decreased. What do you make of these findings, and how did the pandemic really exacerbate these trends?
Yes, the findings are so unfortunate. You know, in a country where we spend the most per capita for healthcare, we still don't have adequate healthcare for moms and families. And we saw overall a 2% increase in the number of counties that have no hospitals for maternity care, no obstetric providers, and no midwives. And that's just unfortunate. And we know the pandemic was a huge contributor. Hospitals and maternity centers, both in rural and urban centers, are experiencing extreme financial difficulty. There have been closures of maternity care units in many counties, and there have also been a shift in providers. And we noted that the increase in maternity care deserts is largely due to that fact, hospital closures and a decrease in obstetric providers in those areas.
Going back to this report again, Dr. Henderson, 36% of all U.S. counties considered to be maternity care deserts, and 2 in 3 of these deserts are in rural areas, which is a point that you just touched on. Why is that?
Well, partially because the majority of obstetric providers practice outside of rural areas. Only 7% of obstetric providers practice in rural areas. And although the majority of maternity care deserts are in rural areas, we still see a decrease in maternity care in urban areas as well. And we don't want to forget them.
We don't at all. Dr. Henderson, the majority of women living in maternity care deserts are non-Hispanic white. Only 1 in 4 Native American babies were born in counties with limited or no access to maternity care services, and so were 1 in 6 Black babies. Why is it important to understand these racial disparities, and what are some of the underlying causes that are contributing to this?
So unfortunately in our country, particularly American Indian and Alaskan Native and Black mothers experience the worst outcomes from pregnancy. Black mothers are about 3 times more likely to die from pregnancy complications, and American Indian mothers about 2 times more likely to die. And then when we also consider about 50 to 60 times more women actually experience complications and don't die, and these populations are disproportionately impacted, we have to realize the impact of not being able to have access to high quality care. Often these families have to travel long distances and may not have the resources. Often they have to wait long time to get appointments. And that's just compounded on the fact that they already experience the worst outcomes from pregnancy.
A problem that needs to be addressed for many reasons. Dr. Jakiba Henderson, thank you so much for your time. We appreciate it.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.